Hi, I'm Dr. Ashley Hughes. I'm a veterinarian at the Friendship Hospital for Animals in Washington, D.C., and I'm going to talk to you about some common health problems that can arise with your dogs and cats.
Last year, I adopted my now 1-year-old dog Poppy as a tiny, fluffy puppy. As the month passed, she's developed into a beautiful dog that has the personality of a Category 5 hurricane. Since then, I've become very interested in behavior topics and have found what I, as well as the American Veterinary Society of Animal Behavior, believe is the best way to train your dog. This technique, called behavior modification, allows us to learn to listen to what our pets are telling us through their actions and body language. By working with them in this way, we can show our dogs how we would like them to behave while strengthening our relationship at the same time. The basic principle behind behavior modification techniques is to consistently and constantly reward your dog for appropriate behavior while ignoring the undesirable behavior. You must teach your dog to sit quietly to earn anything and everything he wants for the rest of his life. And if you're thinking that that sounds difficult to execute, let me tell you, it absolutely is. Ignoring undesirable behavior does not mean looking the other way while your dog chews up the couch. Instead, when this behavior occurs, you give your dog an appropriate toy to play with and praise him when he uses it. Screaming at your dog and punishing him is neither productive nor humane and can negatively affect your relationship. Another important aspect of behavior modification is teaching your dog to defer to you, so that he learns he must sit quietly for something he wants. This is not dominating your dog, but rather teaching your dog to look to you when he needs something, be it attention, food, or how to act when someone enters the house. Here's an example from my own life. Often when I'm sitting on my couch, one or all of my 3 dogs will run up and leap on me for attention. When I start petting them, this reinforces their idea that anytime they want something, they can jump on me to get it. What should happen instead is that when a dog wants attention, they will come up, sit, and wait for me to invite them to come closer for affection. Let me be the first to tell you, this is not easy at all. The most difficult aspect is consistency. I have to be mindful of teaching Poppy 100% of the time, every day. Here's another example. Every time we come to a door, Poppy must sit and wait for me to tell her it's okay to walk through the door. I'm sure you can imagine when I'm running late for work and trying to get out of the house in a hurry, pausing to train Poppy is the last thing on my mind. Another challenge is that Poppy loves barking like a fiend every time someone comes over. This is not enjoyable for any of the humans involved, including my neighbors, who are just thrilled to hear Poppy's loud, distinctive bark. In an ideal world, when someone knocks on the door, Poppy will sit and look to me, waiting until I tell her it's okay to greet them. Our visitor will not enter the house until Poppy is sitting and waiting quietly. Note that I say, in an ideal world. This bit of behavior modification has been especially challenging for us and is currently a work in progress. Though patience is not typically one of my own strong suits, it is crucial to teaching these techniques. When I have a guest standing outside my door waiting for 10 minutes or more until Poppy starts barking, it can be very difficult to maintain a calm demeanor. Along with improving quality of life for yourself and your dog, learning how to behave can also have a significant impact on your dog's physical health. Here's an example of why this is so important. Recently, I saw a 1-year-old dog on an appointment for skin issues. He was a very sweet dog and very excited and would not pause in his leaping around the exam room long enough for me to do a complete exam. His owners were not concerned with his behavior as they felt this was normal for a dog of his age. It isn't. What will happen if this dog continues to act like a crazy creature every time he visits the hospital? When we need to perform common procedures such as trimming his nails or collecting blood, he will need to be tightly restrained. If he does not care for this, and most don't, then he will protest and become more fearful of going to the vet. Through no fault of anyone's, he will develop a negative association and learn that people hold him down when he comes to see us. Each time he comes, his behavior will become progressively more fearful until he eventually tries to bite someone and is now aggressive at the vet. This unpleasant scenario can be avoided if his owners start behavior modification so that their dog learns to walk into the hospital and sit calmly with minimal restraint for his exam and blood draws. For my part, I always try to show my patients that coming to see me is a happy event. I give them lots and treats of pets whenever I see them. I would like to discuss the other lines of thought that exist with regards to training techniques. Among them, the method of dominance theory that includes the punitive training techniques made popular in the last few years by Cesar Millan in his Dog Whisperer television program. Millan's training revolves around what is known as dominance theory. According to the school of thought, you must establish yourself as the alpha dog while keeping your dog in a submissive role. A central theme of this technique is that dogs that are fearful or aggressive are trying to obtain dominance over their owners or other pets in the house and must be put in their place, oftentimes using force. People who believe in dominance theory will tell you it's based on studies of wolf behavior in the wild. What they may not be aware of is that these studies were conducted back in the 1960s and have since been proven inaccurate. In just the past decade, we have learned that wolves in the wild do not fight to become an alpha dog of the pack. Rather, their packs are families consisting of a mating pair heading up a group of their offspring. Here's the main problem I see with dominance theory. Maintaining your alpha dog status requires that you routinely behave in a threatening manner, often using physical force to those submissive to you. And you must ask yourself, is that the kind of relationship you really want to create with your dog? It's certainly not one I would like. Dog Whisperer may be entertaining television, but it should not be used as an example of how to train your dog. Most of Milan's techniques are primitive and oftentimes inhumane. So much so that there was a public outcry calling for National Geographic to remove the show after an episode in which Milan uses a choke collar on an unruly dog until it collapsed, gasping for breath. Though National Geographic did not stop airing the show, they now post a disclaimer cautioning people not to try these techniques at home. Proponents of Milan argue that he saves animals that would have otherwise been euthanized for aggressive behavior. But it is commonly accepted in the behavioral community that for the most part, aggression in dogs is rooted in fear and mistrust. So the techniques of dominance theory can actually lead to an even more fearful animal. The American Veterinary Society of Animal Behavior put out a position statement warning that using punishment training for behavior problems can lead, and I quote, to potential adverse effects which include, but are not limited to, inhibition of training, increased fear-related and aggressive behaviors, and injury to animals and people interacting with these animals. Though I don't agree with his training methods, I'm sure Milan believes he has the animal's best interest at heart. He is a huge supporter of shelters and rescue foundations. His center in Los Angeles takes in many abused and rescued animals that would most likely have otherwise been euthanized. Still, I feel it's my responsibility as a veterinarian and dog lover to clearly state I do not believe in following his methods. In the end, it's up to you to choose which method to use with your dog. On one hand, you have a technique like dominance theory that initially may seem more simple, but based on research that is no longer valid and it requires you to use physical force when your dog acts out. Then you have behavior modification, which you can use to create a situation where your dog has self-control and looks to you for guidance. My hope is that you will embrace the challenge of behavior modification and use it to create a relationship with your dog that is based on trust and communication, never fear and intimidation.
Thank you for listening, and all of the information that we talked about can be found at www.friendshiptales.com. If you'd like to send me an email, you can at ahughes@friendshiphospital.com. Thank you.